What people are anxious about is going to the surgeon means you need surgery.
Right.
But if you look at what comes through my door, or who comes through my door, out of about 20 patients who come to my door, maybe 1 or 2 will require surgery. So the percentage of patients who require surgery is quite small. So they might come to see me, for example, for a tummy problem, a tummy pain, which are often due to constipation or irregular bowel function, and those are all situations where I can deal with basic with some education on diet and fluid intake. So majority of patients who come to see me are due to functional problems.
Yeah, what do you mean by functional problems?
Functional problems meaning that if the bowel is not functioning properly, like
right.
what they're eating is not appropriate, or they're not eating enough fiber, they're not taking enough fluid. So if that's the case, then the bowel doesn't work very well.
Right.
They don't open the bowels regularly. They don't open the bowels regularly. They tend to be constipated, and also the constipation is also associated with the fluid intake. So if you have enough fluid, your feces is soft and easier to be expelled. And along with bowel function comes urine function. So if you've got a loaded colon, loaded bowel, it can compress on your bladder and cause you some urinary symptoms as well. Okay. And if you've got constipation, you're also prone to more bacterial overload in your feces, and especially in girls, you can get more frequent urinary tract infections.
I see.
So basically, most of them I deal with this condition. I make sure that they have good, appropriate fiber and fluid intake, and with that, most of the symptoms can be treated.
Surgery is very much a last resort.
That's right, yeah. For these situations, with functional problems, they don't require any surgery.
Right.
There are some conditions, of course, where surgery is required. When they have a hernia, for example, so a lump in the groin. A lump in the groin, you need to assess and see what the cause is. Sometimes the child can have retractile testes, the testes is going up and down, and the parent finds a lump in the groin, and there's actually a testes. And this is a normal condition. The testes moving up and down is normal. And undescended testes, where the testes never come down to the scrotum, require surgery. Retractile testes doesn't require surgery. And sometimes the retractile testes, which is up in the groin, they think it's a hernia. Then they come to visit me. I'll reassure them it's a retractile testes, is completely normal. There's no surgery required. And the same with retractile testes, thinking it's undescended testes. If I can bring the testes down to the scrotum, they won't require surgery. Right. So vast majority is children that come to me. I often reassure the parents that there is no surgery required. It's a normal situation, and I will also teach them how to examine the child, also what to look out for. What's the difference between undescended testes, retractile testes, and a hernia. And if it's a hernia, you come back and see me, and we might need to do surgery. And of all the situations, the chances of them coming back to have a surgery is again 1 in 20.
Right. Okay. Thanks, Doc.